given the limitations around the data, is less than 7%.
And is that, you want to talk about the problem with the getting all of the tests? So because this next question we have here, it says, experts have said that municipalities with positivity rates over 5% should consider rolling back reopening plans to get the virus under control. Why haven't you considered further rollbacks? And what positivity rate would you consider rollback? So we want to talk about, we're consistent in how we're reporting positivity, but we're not getting all of the tests that have been administered to really understand the true positivity rate. Would you like to elaborate on that?
Sure. Again, to calculate positivity rate, you take the confirmed case count and you divide it by the number of tests administered. In our case, we know the confirmed case count, but we don't have a complete number of the total tests administered. There's various settings that aren't reporting into the state in a timely fashion, which just creates challenges for all of us. And that's why we recommend that the public look at this number in terms of a trend and directionality and not necessarily as an absolute number. In fact, we strongly suspect, based on other information that um, hospitals are telling us, our overall community positivity rate is much lower than our current listed value.
That would be just, again, be simplistic because we're not getting all of the tests reported. We only get the negatives back. So, but
We're not getting all of the negatives, correct?
the important thing is the trend that we see, and we want to continue that. And we apologize that we don't have the data. The data is not available to us. So, but the trend obviously is, and that ties into the 5% question on whether or not we should consider rolling back reopening plans. You heard me talk about bars, and bars need to really do a better job. This weekend, the governor's rolled back gatherings from 50 to 10 people. So if the trend is not reversed, you can expect further activity in this area. Okay, let's see. Dr. Moyer, you said hospitalizations are increasing. Do you have the data on hospital occupancy rates for COVID patients and the current capacity of ICU beds and ventilators? Or Grace, to you.
Grace, I'll let you take that one first, and I'll add anything.
So again, bear in mind that things such as hospitalization and hospital occupancy rates continue to fluctuate. These are near real-time numbers. But again, what we're seeing right now from the hospital systems is that we have plenty of capacity, and we're working on better ways of being able to communicate that to the public, for more transparency. But for the time being, be aware that we track this and that there is adequate capacity.
And you want to explain why? Just explain why we don't have the data. We're very frustrated with this as well.
Well, I mean, part of it is we have a different reporting needs. So I think it's been well covered in the national media that Health and Human Services, the Department of Health and Human Services, has been having the hospital systems transition over to a new system for reporting their hospital data, and that's impacting our ability to get access to it. In addition, from a daily perspective, as we've noted, in particular around ICU and ventilators, when you have such low numbers, it's easy to accidentally or inadvertently re-identify people. We have an obligation to protect patient privacy. And so we're working through these concerns with our partners in the hospital systems.
So that I think Marcus Green nicely says, respectfully, the data doesn't help anyone understand anything. I'm not sure what you're talking about there, Marcus, if that's positivity, but he follows it up with, why can Kentucky and Indiana, the state level, provide the information, I guess, around positivity and hospitalization, but the city of Louisville cannot?
And again, the data is not organized that way. It's not categorized at the county level, it's categorized at the state level.
We wish that was not the case, Marcus. We can get some individual hospital reporting. It runs into the problem that Grace talked about. So we recognize this is a problem, and we're trying to find a way through the healthcare protection laws right now and data aggregation so we can be more discreet with our, or more specific with our reporting. Okay. Yeah, so Marcus said that was about the positivity rate. So again, I think we've answered that, Marcus. It's like, since we're only getting the positive results and not the negatives from everybody, that's why that denominator is smaller in that calculation, and that is a state data bottleneck that we're having. Okay,
And just to emphasize, I think with that, like the hospitalization numbers are trending up slightly. There's still plenty of capacity today, but that is just, it's just not a great sign that those are starting to trend up. ICU beds are, have plenty of capacity today.
let's see, last question on here. Are cases of COVID-19 at large warehouses and factories where employees work in close proximity to one another a concern at this time? And how is the city responding? Sarah?
I can answer that. So that's not where a majority of our cases are coming from right now. That was a big issue when they were one of the only businesses open when the rest of us were on stay-at-home orders. We have protocols in place to be doing screening tests and ways for those employees to get tested as soon as they have symptoms, and are working closely with all the factories in the city. So not a big cause of the increase in cases we are currently having. So
We did hear, JBS Swift early on was a challenge for us. You might just want to talk about then how we arranged for testing at the Family Community Clinic that was a half block away. This is an example of how we address some of these issues.
Yeah, so we've got testing plans in place for all of the factories. JBS, as an example, did testing with their employees, and now they've got a contract in place with a local healthcare provider to continue that on an ongoing basis. So monitoring it closely, but not a cause of the recent increase in cases.
All right, folks, that is all of the questions on there. Obviously, the big takeaway, the trend is not our friend right now in terms of upward moving with the trend. So please, let's just communicate through the media about these basics that everybody can do to keep us safe with mask and distancing, staying at home, and washing our hands. So we've seen other places get this under control. Our big question is, when are we going to flatten out? We don't know that. We're peaking and we're still increasing like we are right now. So we know what to do. Let's do it. Thanks for joining us today.
Hey, Virginia. All right. It is Tuesday at 4 p.m. in our continued war against COVID-19. We know, based on what we have been seeing over this last week, where really we had at least 5 of the highest days on record, that it's serious and that it's escalating. Again, the positive news is that we know how to beat it, and if we are committed to it, we can and will do what it takes, but we are in such a critical period. First, across the United States, cases continue to escalate, and while we'll talk about travel advisories and others, remember this is one country, and this virus doesn't respect borders. And we put policies in place to do as much as we can, but as this virus is surging across the United States, it's ultimately going to surge in a number of different places. Here in Kentucky, our surge continues as well. Today we are reporting our second highest ever daily total with 674 new cases of COVID-19. That's not good news. And when you look at good news, you can look at our mortality rate, which we talked about the other day. One of the lowest in the country. Our mortality rate is at about 3%, but that would mean if it continues to be about that, today's number might indicate the loss in the future of 20 Kentuckians. So I hope when we see 674 new cases, that we know that we have got to do better, we've got to be committed to doing better, and I see a lot of that out there. And we've had reports in from a number of counties. Harlan County's judge executive just the other day called and provided a statement we put on social media about how he is seeing the vast majority of individuals in his county go from not wearing a mask to wearing one every day in the areas that we need to see them. And we're seeing that across Kentucky. And so as we go through now to really probably this time next week, we really hope that we can see these cases to stop escalating, to plateau, and then hopefully over time to stop going down. That's what we've got to do to make sure that we are not one of these other states where their cases are exploding and we still have time to act, but we got to know that we are on that trajectory, we are on that path without everybody buying in and doing the right thing. We now have 24,060 cases of COVID-19 since this pandemic started. Obviously, if you look at the last 10 days, 2 weeks, even 3 weeks, a very large portion of that has happened very recently. It means that maybe now is the most important time during the course of this pandemic, after stopping it from doubling every couple days or 3 days, which was the concern early on, to make sure that we can get the upper hand, that we can control this, that we can keep our economy open, that we can save lives, and that we can get our kids back in school. Today, 674 new cases include 22 kids under 5. And I think we'll be able to show you some data tomorrow that shows the percentage of daily positives of kids under 5 is increasing. It's really increasing significantly. Now, early on, we weren't testing a lot of young kids, but what we're seeing is when we say more young people testing positive, we actually sometimes mean really young individuals. And so we've got to make sure that whether it's in our child care centers or at our homes, that we're doing everything we can to protect our loved ones. And remember, we can't send kids with positive cases to school or to daycare. And so if we allow our numbers to increase amongst our young people, it makes it really challenging. It puts our teachers at risk. And Lieutenant Governor Coleman's going to provide an update on our steps as it relates to education and school reopenings here in just a little bit. I want to show the current map of Kentucky. This is before today's results. With today's results, we will have at least one other county turn the deepest color here, which is meaning 100 to 5,300 cases since this started. There is no safe region in Kentucky anymore, and some of these areas that are still the lighter colors, remember, so was Harlan and so was Bell. And Harlan will turn that darkest color here after today's report, and it happened almost overnight. There is only one way to address this virus, and that's with statewide policies, because when you can have 100 cases over the course of a week, surely to God we all want to prevent that, and not to say there's not a problem here until it's out of control. That would be taking approaches like we are seeing in certain other states where the numbers have to be in the thousands before we act. That would be what would be happening on a smaller scale in our counties. And listen, do we want to pretend like people don't drive from one of these counties to another every day for work or to shop or to do other things? Now, this is important that we make sure that we are all doing our part throughout Kentucky, and I think every public health expert here in Kentucky would agree that this is the time for statewide action, all of us coming together, make sure we get this done. Number of total tests, 549,208. As you all know, we read these numbers every single day. That you can know the overall tests we've done, and by simply subtracting the previous day, you can know the number of tests that have come in today. Number of patients currently hospitalized, 532. This is a worrisome number because it's higher than it's been in a number of days, though it'll oscillate a little up and down. Good news is we still have a number of hospital beds out there. We're not at that critical point yet there, but that's yet. 600 cases a day, that can change pretty fast. Total number of patients in the ICU, 136. Number of patients who have recovered, 6,927. Our COVID-19 positivity rate, 4.37%. Now, understand that we calculated on a 7-day rolling average, and depending on when your 7-day starts and ends, or if you do a 14-day average or a 5-day average, then you get a different number. This is the consistent number that we've used. We believe that it's the right one. It goes up and down a little bit, but in the 4s is not a place we want to be when we were in the 2s just recently. And also understand with that positivity rate, we can't attribute our number of positives simply to more testing. And when we have more testing and more people test positive, it means there's more of the virus out there. We're just learning about it. And I hope that we can all want to know as many people as possible that have it, so we can not only help treat them if they need it, but help prevent them from spreading the virus to other people. Our new cases by county, we have a number of counties today in the double digits. Jefferson with 180, Fayette with 35, Warren with 24, Barron with 23, Harlan with 22. That's why they'll go to the darker color. But I got to tell you, that's one county we expect, at least based on the feedback that I'm getting from people really buying in to wear a facial covering, that hopefully we can stabilize this. Madison County, 22, Hardin, 19, Kenton, 17, McCracken, 14, Bullitt, 13, Campbell, 13, Henderson, 13, Boone and Casey and Davis, 12, 11 for Oldham, 10 for Laurel, and then the list is really long after that, but this will be on our website like it is every day. Today we're sad to announce 3 new deaths, and yes, the deaths are lower, which we like to see, but remember they trace by about 14 days. They lag by about 14 days or more from the announced cases. They include a 95-year-old man in Shelby, a 63-year-old man in Callaway County, and a 91-year-old female in Casey County. Again, we continue to see a lot of people in their 60s passing away, and I hope none of us believe that that is old. Ethnicity and racial statistics will be on our website. We continue to see a large number of cases in our Hispanic population, making up 15% of cases. We continue to see a disproportionate death rate. It's about the same as yesterday in our Black and African American population. Long-term care facilities continue to get hit. 7 new residents, 24 new staff members testing positive, 6 new deaths attributable to those in long-term care facilities, and 1 new facility. And so, folks, where we are today and what we're seeing is exactly why we are taking additional steps. Now, know that there hadn't been enough time for when infection occurs for us to see the results of our requirement that people wear facial coverings. But that requirement will only work to stop this increase of cases if people do it. And they can pretty much scientifically prove now that if we can have 90-95% of people wearing them when they're out, when they're wearing them within 6 feet of other people, it'll work. It'll absolutely work. And we can do almost everything we want to do, from saving lives to keeping the economy open. If we can do that and get this thing under control, it will make what we can do in schools so much easier. But we need your buy-in to do it. Remember, everybody else is counting on us. This isn't just us getting in a car determining if we want to wear a seatbelt. It's like us getting in that car knowing that if we don't put ours on, 6 other people can't put theirs on even if they want to, because you could be spreading the virus to them and they can make the best decisions, but you're still putting them in danger. Let's make sure we don't do that. So to give you an update on steps that we have taken since we have started seeing this escalation, all of these steps are ones that are proposed or have been talked about by the White House itself. These aren't partisan. These are experts that work for a Republican president or a Democratic governor, and that other steps are taking. Number 1 is our requirement that people wear a facial covering. Number 2 is our travel advisory. I need you to cancel your plans if you're going to a beach in Florida or Alabama or South Carolina or any of these states. It is just not safe. And time again, we've now seen people come back from these vacations and spread it in their work, in their church, and in other places, in their weight room, shutting down athletic endeavors. Let's not do that, and let's understand where we are and where they are is a dangerous time, and let's change our plans and try to find some other way in Kentucky or where it's safe, perhaps a different state, though we didn't set the bar very low. 15% is pretty dangerous. 10% is pretty dangerous. We're trying to make this as reasonable as possible for everybody. Then the third piece is now at social gatherings, and this does not apply to anywhere, to any venue, to any church. They have separate guidance, to workplaces or to the rest. This is your backyard barbecue. This is having friends over to your house. This is your block party. It's where it's spreading, and that means we're spreading it to our friends and to our neighbors because we let our guard down in these situations. This is also something that the White House has suggested when you start seeing a surge. We've got to do it. It's going to help make sure that if someone comes over and maybe has it during that period, that it's 10 or less people that we need to talk to make sure they don't spread it, and not up to 50 that can continue to spread it further. And let's remember what's at stake here. We talk about lives, we talk about $10 billion of our economy, and we talk about schools, and none of those are in doubt. We know that we've got to get control of this virus to preserve all of that. But I think if we look at the White House's other recommendations for states that are surging, certainly worse than ours, you see what would be a real blow to our restaurants, which have already been through too much. I don't want to have to do this. If we have a surge that's tough enough, following the White House's guidance is something we're going to be expected to do. Also, I still hope that our bars, our entertainment venues, can operate safely, though it's incumbent on all of them. And the challenge with this disease, this virus, is if one is out there not doing the right thing, how it can impact so many other people. So that's the tough news. The good news is we're starting to see people's energy and enthusiasm in doing the right thing pick up. So I'm bringing something back that we haven't done in a while because people need to see it. Which reminds me, we're going to get through this, and we're going to get through it together. We got a little positive social media because it's been so negative out there, and people trying to do the right thing, I know, have felt beaten down. Trust me, I understand how that feels. But it's going to give you a little bit of an idea of some things going on out there, because we can't see a lot of what's going on out there in our world right now. If you're like me, you're going from work to home, and Groundhog Day occurs day after day. But look at this. This is one of our recovery stories. Lily, Mabel, and Bonnie are all wearing big smiles because they beat COVID-19. Look at that. This is from 20 hours ago when we pulled it. 3 survivors that got their green balloons. This is worth fighting for. And I tell you what, I don't think I've ever met any of these 3 women, but I will wear a facial covering every day to protect them, and I hope everybody else will too. As school approaches, this is again, folks trying to lift people's spirits up. This is an 11-year-old out there, an 11-year-old. Trust me, I've got one. I've also got a 10-year-old. And I know that there are ups and downs, but if they believe that we can do this and they know what it takes, and it's pretty simple to them, and they can see rainbows in these days that we're going through, we should be able to too. You know, our kids mope a little bit, and you know what? They then get up and they do what it takes and they move on and they find joy in what they can do. I just think we've got to take a lesson from that for our perseverance, from what it's going to take for us moving forward. All right, now this is one of my favorite performers. He's in Lexington, again showing how he can show how they can show their own style, but also the fact that he is wearing a mask for others. I know he's been through some tragedy too recently, and we're thinking about him for that. All right, open, healthy, safe, and clean. This is every workplace, what we ought to see. It ought to be, you know, every approach that we have. How can we be the healthiest we can be today? How can we create the very safest environment? All of us ought to be thinking about that each and every day. We do it here in the Capitol. We actually have a nursing staff that now takes everybody's temperature every day, goes through the checklist, and I got to tell you what, they've been an amazing addition here. Not just to keep us healthy, but to lift our spirits. They feel like as much of a part of the team as anybody who was here 6 months ago. And while I hope there's one day where we don't have to do temperature checks coming into the Capitol, we're going to miss them. They gave me a really nice card today, help lift my spirits. Yeah. You know, we used to say heroes don't wear a cape, they wear a mask, and we were talking about our healthcare professionals. Now we're talking about everybody. And here's Berea, just with an acknowledgement that we continue to lose people, that we have to continue to be compassionate and kind with one another. And let me say to all the folks that are out there that are enforcing this requirement of a facial covering, you're doing the right thing. You're helping to keep your businesses open. You're protecting people's lives. I know there are people that aren't always nice to you, and for that, I'm deeply sorry. But we're calling on you right now to help us do a critically important thing. And if somebody's unkind to you because you're asking them to do the right thing, it doesn't say anything about you. It says something about them and how they treat their fellow individual. And to those that are frustrated by it, don't take it out on other people. You know, they're just trying to do what they need to do to keep their business open. With today being the second largest number of cases, I'm going to ask Dr. Stack to come up and comment on our trends, and then right after that, we'll have the Lieutenant Governor give an update on education.
Thank you, Governor. So, 3 things actually. The trends that the Governor just mentioned. These numbers today are not a surprise. They unfortunately validate where we are in this journey. Having nearly 700 new positives puts us solidly at the base of that escalation of the curve. It's consistent with what we've seen last week, where our numbers clearly broke out of a multi-month stable period. And so it's a reminder to us we've got to do these steps. We've got to take action to be more disciplined about socially distancing, using our masks, and doing the things that we know will work. I wanted to share 2 different thoughts here. Over the last week, as I interact with people and different topics come up, I just sort of want to share information about 2 concepts. One is to say we would like to be as precise as we can be in our interventions, but one of the ways that I think precision is just not realistic is if we want to do things county by county, it just doesn't work. And so I'm going to put this in context for you. So this virus that we've said over and over didn't exist until late last year was an unknown entity in Wuhan, China, which is about 7,500 miles, 7,500 miles away from Lexington, Kentucky, where I live. And that virus managed to make its way over to New York City in 2 months from China. And within a month and a half, New York City was underwater with COVID infections overwhelming its hospitals. So I wrote this down here, from Pikeville to Paducah is 375 miles on Apple Maps. And so if we don't think that the virus can get from Pikeville to Paducah in less than 2 months, when it got from China to New York City, which is about 7,000 miles apart in 2 months, then I think we delude ourselves and that we're not being realistic. So to think that a city like Bowling Green, which has had already a period of increase in recent months, or Jefferson County, which encompasses Louisville, or any other area, can't spread its infection just over a county line or a couple county lines very, very quickly when people are as portable as we are, I think is just not consistent with reality and not consistent with the nature of this disease. So we will continue to look for ways to be as precise as we possibly can so that we limit the impact as much as possible on our daily activities. But at this point in time, with the information we have and the way the virus behaves, we simply can't be that precise. The other thing I wanted to share is people focus on, and at times assert, that there's an attempt to fearmonger related to this, and I dispute that. I think we've been very balanced and very clear. It appears the vast majority of people, at least acutely, do just fine with this illness, but the problem is 15 to 20% of people are at higher risk, and if you're in a higher risk category, you don't do just fine with it. If you're over 60, that accounts for 9 out of 10 of our deaths currently by our current statistics. There are certain populations, and they're large numbers of people as a percent of the population of Kentucky, who are at high risk and who could have a very terrible outcome. But I don't want to just focus on mortality. There's a lot we don't know about this disease, and I don't think people put this in context. So I'm going to rattle some other things you know. Chickenpox. Chickenpox for kids a lot of times is a relatively benign disease, but not completely benign, and some kids can have a bad outcome. But it's a gift that can give again. So as you get on in life, if you are unlucky and you have illness or an immune system problem or other issues, you can have shingles. And shingles is a very painful rash that comes back in one nerve root. The virus never goes away, it just sort of hides. If you're unlucky, it can permanently damage the nerve and you can have really severe pain for an extended period of time. Now there's a herpes virus, and the one that most people think about would be cold sores perhaps, but herpes virus that's a genital condition is something that there is no cure for. As long as we've known about this disease, we cannot cure it. And if you are a pregnant female and deliver a child with active herpes outbreak, your child, if they get infected and have neonatal herpes, can have a 1 in 4 chance of dying. Hepatitis C is a viral infection, as is hepatitis B and the other ones. The early illness may have you laid up and sick initially, but then largely your body compensates for it and takes care of it, but it can reemerge decades later and cause cirrhosis, liver failure, and liver cancer. And so that's something that, while you may do fine for a number of decades, could still shorten your life by multiple decades, although now very recently we have treatments that are curative but very expensive. HIV/AIDS. HIV has been with us since 1986. We still have no cure for it, and in the initial years, and actually for quite a while, it was a disease we had very imperfect treatments for, and if left untreated, it destroys your immune system and you die from overwhelming infection of other sorts. Now, thankfully, we have treatments that can suppress it, and if you're compliant, you can lead a full and productive life even with the illness. And the last one I'll mention is one of the rare instances where we have not fully eradicated it from the world, but we've largely eradicated that, and it's polio. And polio, and a famous American would be Franklin Delano Roosevelt, one of our former presidents, who was a vibrant young man in his 20s and had an acute episode of polio and then was a paraplegic the rest of his life and reliant on a wheelchair. So that could take someone who was vigorous and healthy and cause them a permanent and severe disability. With SARS-CoV-2, which is the name for the virus that causes COVID-19, we know that it causes stroke in some people, it causes severe inflammation of the heart muscle called myocarditis in others. It causes respiratory failure in many. In a number of individuals, it's almost as though you've poured Drano into their lungs because they have permanent damage afterwards and have multiple months of prolonged problems with low oxygen levels and difficulty recovering. It causes blood clots in your lungs called pulmonary embolism. In kids, we now know that the kids don't show any signs sometimes, and then a couple months later they develop a multi-system inflammatory syndrome that puts them up in the ICU and is very serious and threatening. And there are other issues like perhaps long-term cognitive impacts or neurocognitive damage that we don't fully understand. And of course, it also can cause people to lose their sense of smell, which is a neurologic problem, so it's clearly involving the nervous system. And this disease has only been around for 6 months. So those other conditions I mentioned, those other illnesses, we've known for decades and have cataloged what happens in people. This one's been around for 6 months. We don't know what happens. We don't know what the long-term consequences is. And I think people need to know that, because when we take the steps we take to try to protect Kentuckians from this illness, it's because there's much we don't know. What we do know is terrifying for the people who are most vulnerable to it, but we don't really know the true extent of our vulnerability and who will ultimately be impacted and who may have chronic long-term consequences. I don't consider that fear-mongering. I consider it informing, and I think people need to be informed that there are a lot of reasons why people who devote their lives to medicine and public health are very concerned about this infection, and why we recommended the things we have to try to protect you from it. Thank you very much, and Lieutenant Governor.
Thank you, Dr. Stack. Before I begin with the back-to-school announcements, I want to take just a second and say thank you to everyone who reached out concerned about my bonus son who had a positive test for COVID-19 a few weeks ago. He was one of the lucky ones. He was asymptomatic. We test periodically, so this is why I would say it's very important that you get tested. And he did everything he was supposed to do in terms of quarantining, eventually got negative tests back, and was able to be released by the health department and is feeling just fine. So thank you all for your concerns with him. So we're talking about Healthy at School today and how we are going to allow some flexibilities for school districts to be able to meet the needs of their communities and their families. So I want to give a little bit of a repeat of some of the things that we have done so far, as well as make a couple new announcements. So first of all, we have worked in conjunction with KDE, the Education Continuation Task Force, and others to release the Healthy at School guidance. We sought to give leeway to our school districts so that they could make informed decisions that best serve their unique challenges. We need our school districts to make sure that they are flexible in order to keep our students, our teachers, and our families safe. And I'm happy to say that the vast majority of school districts have done this the right way. They have surveyed their community members, their teachers, their families, and their students. And one point that I want to make, and I cannot say this enough, is that at the heart of every reopening plan should be the health and safety of every child and every adult in the building, as well as every family they go home to at night. That should be first and foremost. As a parent, I recognize that the measures that schools must take to keep everyone safe complicates things for families. So parents, I ask that you extend grace to our superintendents and school leaders who are faced with these tough decisions in ever-changing circumstances. As a teacher, I feel the concerns of my fellow educators about reopening. We are talking about the boots on the ground where the rubber meets the road in the classroom, and our educators are the folks who are going to do that work every day. Their voice has to be heard, and it has to be elevated, and it has to be a part of every reopening plan because they are the experts. I promise that we will constantly review how we are responding, and we will look to the statistics and the medical data as we make our decisions moving forward. My plea to you is to stay with us and to stay together. This circumstance around the virus continues to change, and we must all be adaptable to these less than ideal circumstances. So I want to highlight some flexibility that we have given to our school districts so that they can meet the needs of their families. First of all, we made sure to allow for unlimited NTI days or non-traditional instruction days. This is so that if schools decide that the best move for them is to go to full digital instruction, that they are able to do that without any limitations. The second thing that we've done is we remove the average daily attendance requirement from funding. The important note about that is our funding for our schools is tied to attendance under the pretext that either every child is out of school, for example on a snow day, or every child is in school. So by removing this barrier, this allows schools to create hybrid models where they may bring in some students on some days and some students on other days to be able to create that flexibility. We also announced the expanded care program that will help provide funding for school districts with a 3-to-1 federal match for things like mental health services and behavioral health services, because we know the isolation and anxiety that has circled around these circumstances have impacted our kids as well as adults, and they need all of the help and services that we can provide. Today, I want to announce that we are providing unlimited COVID-related emergency days for faculty and staff in school districts that must quarantine because they have been exposed to the virus. Additionally, the Cabinet for Education and Workforce Development is engaged in discussions with both public and private groups to expand Wi-Fi in areas of Kentucky who need it the most, and I hope to have an official announcement coming on that soon. On Thursday, the Kentucky Department of Education and the Education and Workforce Development Cabinet is hosting a virtual town hall on reopening schools. This is particularly for educators and school staff. It will be this Thursday from 2 to 4, and I will be joining, Interim Commissioner Kevin Brown will be joining us, and Dr. Stack will be joining us as well. Our teachers and school staff can submit their questions to the webcast beforehand, and all of the information can be found on this slide or also on KDE's website. So finally, I want to make sure that folks know that last week I wrote a letter to Secretary for the U.S. Department of Education, Betsy DeVos, the Kentucky Congressional Delegation, and my state education secretary colleagues from across the country with an appeal for an additional round of flexible CARES funding for our state budget, the majority of which is taken up by public education. The reason for that is because the future of Kentucky's economy is in our classrooms today. Every one of us, every family member, every parent, every child has been forced to adapt our way of life because of this pandemic. Our education funding must be adaptable as well. If we have some school districts who decide that they want to go full digital, they should be able to apply their resources to increase technology and broadband access. If we have other schools, and maybe in larger rural regions of the state, who are going back in hybrid models in person, that will allow them to be able to spend increased funding on transportation for additional bus routes and PPE for the folks that are in school. The flexible funding for P20 education is necessary because all of our schools and college campuses have to keep students safe and they have to keep them learning. So today I urge Congress and our national leaders to meet this moment so that we can meet the needs of our communities in this unprecedented time. Thank you.
So I think any superintendent, any principal would tell you that this flexibility is absolutely critical. Otherwise, once you have, 10 NTI days, which you could even have for snow days, you'd be out. And your funding would be based on the number of kids coming into school in person, which means if you had an outbreak, you would be losing dollars by doing the right thing and not bringing them together. But all this flexibility is made possible by the declaration of emergency under what's called Chapter 39A. And thank God the Supreme Court stepped in and entered the order it did at the end of the week, because otherwise a Boone Circuit order put out today or last night would have eliminated our ability to do this. It would have basically been saying no matter how bad your outbreak is, if you don't put every single kid, every one, back into that school building all at the same time, you are going to lose virtually the major part of your funding, and it would have been an absolute disaster. We cannot get through the first part of our school year without the tools that we have through the emergency orders that we're able to put out, education of our kids, workers' comp for our frontline workers, and so much more depends on it. Let me just finally close by saying it's no secret on how to beat this thing. For a little while, we didn't have all the information we needed, but the way to keep our cases down isn't just to test and trace, that's important, but it's hands, face, and space. Wash and sanitize your hands, do it a bunch. Wear a facial covering, try not to touch your face. And number 3 is even when you are doing all of that, try to keep that 6-foot social distance, and when you can't, pull that mask up. If you're outside and you're 12 feet away from somebody, you don't have to be wearing a mask, but you need to have one on you because if someone walks up within that space, you both need to be able to pull them up. Now, it's something real simple that we can do, and it's something that helps protect us as we move forward. All right, I today have a number of our folks in our media that are here in person. I have a number of questions that have been submitted too. I will do my best to get through this so we can all get out within the hour. Put the graph up. Well, our state number is based on a 7-day rolling average, and we can get you a full, we've got about 3 paragraphs about how we calculate it. We believe that that's the best way to look at ourselves and giving it a timeline of when steps we take can have an impact. Now, if you do a 14-day rolling average or a 5-day rolling average, that's going to change. So if we did a 14-day rolling average, the last 10 days were huge. The 3 before it were a little bit smaller. That would bring it down. If we did a 5-day rolling average right now, our positivity rate would be higher than that 7. We used Johns Hopkins on here because we thought that it was a good source that people could go to and see, knowing that different states may calculate their positivity rate differently on their website. We just needed something easy to go to for people to see. But whether you use a 7 or a 14, our positivity rate's increasing. And I hope people take that out of it in that this isn't just more testing. It's that more people who are getting testing are testing positive. This helps normalize now with 3 or 4 weeks ago when you compare 100 people who get tested to 100 people who get tested. But the answer and why we chose that source is it's easy to get to, and as those numbers change and fluctuate, we think people can readily access it. Those states, most of which on a 5-day average, are higher as well. On a 7, it depends. Florida has had such high numbers at different parts, a 7-day average might actually boost them. And when you get up into the 15% range, you didn't get there immediately to get it up to 15. It's been up there for a significant period of time. All right, from Mount Cross, Speaker Osborne and Pro Tem Meade did a Facebook Live with Richard Nelson of the Commonwealth Policy Center. One-size-fits-all approach needs to go. The approach needs to be more surgical with lesser restrictions in place with low infection rates. I think the experience in Harlan and Bell County, both of which county judges support our facial covering requirement, shows you can go from very few cases to being overwhelmed almost immediately. And when you think about when we put a restriction in place, it's going to take almost 2 weeks to start stemming the tide. In 2 weeks, look what can happen to different places. In 2 weeks, Warren County went from regular to one of the tops in the country at one point. We can't wait for the virus to overwhelm us to act. And if you're in an area with a low positivity rate, that's great. Let's keep it there. Let's make sure that we get that done. And then I think this was Pro Tem Meade. The governor is not presenting data in the same way that other states do. I think we're all presenting data the way the White House asked us to, and if they have concerns with that, they can take that up with the federal administration. But I hope they know about the website, kycovid19.ky.gov, which we have substantial information on. We provide more than many states. Look at our long-term care and how we provide that. I think that we're providing as much data as we can. We even pull out the probables from our lab-confirmed cases. Our goal is just to show everybody every bit of data we have. Chris.
I have a question. I don't know if Dr. Stack might want to answer this one. I think it's a pretty simple question, but I'm trying to figure it out. So when someone tests positive the first time, they go back a couple days later to take a second test to confirm that they're positive. Are their positive tests counted both times towards the total, or is an individual counted only one time towards that overall total?
Let's have Dr. Stack answer that. Now, we are seeing there's some things about this virus that we don't know. The question is about if somebody gets multiple tests and they're positive both times, does it count as two positives? What we have seen in certain circumstances is somebody tests positive and then months later also tests positive. And so it's not just the way it's counted. It points out some things we don't know about the virus. Can you get it again? Does it stick around in some people for a substantially long period of time? There is still so much that we don't know, and a lot of that goes towards, and this is scary, how long will the vaccine help us and protect us and build those antibodies? And those are all things I know that the scientists are working on.
So the question is, do we count one person tested more than once as a positive more than one time? Pretty much, right? And the answer is it depends. So we have, this is a challenge, and I think we try to explain this, and we subject the public wants to understand, I think, but some of the details for this start to get tedious at a point. And not every state does it the same way, though where there is a clearly defined standard, we do try to do it the same way. So here's what we do. When we tell you how many new positives are today, we have deduplicated those numbers. So we don't tell you the same. If we tell you there's 300 positive today and there's 200 positive tomorrow, those are 500 different people. When we calculate test positivity, because for the sheer numbers and the volume, there's just no way to keep up with deduplicating all of that, we take the total number positive reported that day and the total number tested that day, and we divide the total number positive that day by the total number tested. Now, if you think through that, the number positive and the number tested are from different days, so it's not the same group. So to try to accomplish or accommodate for that, we do a 7-day average. So what we're doing now is we're better aligning, not perfectly, but better aligning the numerator with the denominator, because then it's more likely the positives are accompanied by the actual day they were tested. And so that 7-day average captures a better representation, we think, of the positives and the negatives all together in a bigger data set. And it smooths out day-to-day variation, which is not really meaningful, but maybe just noise. So that's how the daily testing positivity differs from when Governor Beshear reports new positives. Those are new, unique positives. You only get reported once as a new case in those numbers the governor reports.
I was just thinking we've been at this a long time when Dr. Stack, myself, and Daniel all dressed almost the same way. All right, Daniel.
Earlier about how we can't limit it by counties, when you've expressed in the past that if you were going to roll back any of the openings, it would be on a targeted basis, basically on county.
The question is, when we talked about rolling back things, how we would do them surgically. First, we're seeing a significant escalation. We're seeing it in almost every region of the Commonwealth. It requires a direct approach. The surgical approach is about trying, if there are specific businesses or clusters that are creating an outbreak, if we have one facility in one county that has 100 cases that have come out, if we have one school potentially that opens up, just because we have one school, if it opens up and it has positives, we're not going to close every school statewide. But when we are seeing vacation clusters in 20, I think about 20 separate counties, when we're seeing backyard type social gathering clusters in you know, a quarter or a third of our counties. Those major guidelines we put into place need to be statewide, but there are some opportunity when we can isolate a specific closure based on contact tracing that we can and we should be more surgical. But after we've had 979 cases and 600 and something, I think we're now at what, 7 of our 8 largest numbers over the past 10 days. That's when we know we've got to do something like this statewide. Is this a recommendation? Can a person's employer ask or require the employee who traveled to any one of the outlined states or has travel plans to quarantine for 14 days? I need to lead that to legal counsel for those employers, but I will say that if I had a workforce and that workforce would interact with each other, would come within 6 feet of each other, I would be very concerned with someone who, knowing the travel advisory, still goes ahead and goes to one of these places where we are just seeing a significant amount of cases. What it does is it puts your workforce at risk. And instead of possibly having 1 or 2 people, you could lose an entire shift pretty quickly with the way that contact tracing works and would have to work. So I would just highly encourage all our employers to be talking to your people, to let them know the dangers that are out there right now, and that it's you put your work, your friends, your church, and everybody else at risk if you do it right now. And I know it sounds so counterintuitive, and we want to not have to deal with the fact that how can going to the beach, something that's supposed to be relaxing and help us in our mental health, be dangerous for our health and others? It just is, and you can see from the numbers. Tom.
Advisory. If you come back and you take a test immediately, you test it immediately, and you test negative, can you end your self-quarantine then?
So if you come back, the question is, if you've traveled and you come back and you get a test immediately and you're negative, is that enough? And the answer is no, because it can take a little bit of time for your body's reaction to the virus or the virus itself as it's growing to show positive for infection. So it can be several days after you're infected before you would test positive for the very first time. But knowing more about that science now is why they can sometimes reduce people's quarantine when they've been regularly tested during it. But it requires that a certain amount of time after that first positive test, enough time has passed. So I think that the local health departments can work with individuals that are worried about it. If somebody just came back, we just put this out, and they want to call their local health departments, they should. And those local health departments should have the flexibility to work with them and can provide them good advice. We fully trust those local health departments that are doing a really, really good job. Joe. The question is, there have been some online statements about an armed protest in Louisville this weekend. Is the state or others or the federal government planning on being there? I don't believe that we have received a request at this time. Obviously, anytime a request comes in, we'll have to look at the danger that's out there for life and safety of folks, but at the moment, we have not received any type of official request for assistance. Lawrence.
Although you hate to lose anyone, the death rate remains fairly low. What does that tell you, and when do you expect it to change? What do you expect to see in the future at this rate?
So this question is, while we don't want to lose anybody, and we have now lost, I don't think I gave the total number, 674 Kentucky citizens. We're all sitting in the rotunda, and again, I'm looking at the wreath we did, I think at 200, and we're now at 674. That's tough news. Our mortality rate at 3% is almost a percentage point lower than the national average, much better than the world average, but it's also 3% is a lot compared to the things that people want to compare this to. Dr. Stack, is the flu 0.1%? Right, so the flu is 0.1%, and this is 3%. There is a world of difference there, and when you see the number of cases we have, 3 out of every 100 is not something that we want to see. The reason that I think it's so low is our healthcare providers and our frontline workers have done an incredible job. So when we look back, the things that changed the modeling, other than Kentuckians doing what it took, engaging in a shutdown that was rough on our economy but saved a lot of lives and stopped a very dangerous escalation. The other piece is how well our healthcare systems and workers have treated individuals. They have been in the hospital for less amount of days. More people have come off ventilators than we would have ever expected. They have just done an incredibly good job. Our hope is as we learn more about the virus, we can do even better. The concern is if we have a huge escalation like we're seeing in Florida and Arizona and others, and we eat up our hospital beds, we eat up our ICUs, and we eat up our ventilators, and we're not there in Kentucky, I want to keep us from being there, then your mortality rate shoots up because you can't give people that same level of care. You don't have the specialized services that they need, and that's what we want to prevent from happening. What we saw in New York is their death rate went up significantly when they were overwhelmed, and we don't ever want to be there. Mike? Yeah, I don't know the way that Johns Hopkins does their data, calculates their rate, but I know that we can show you our number of positives, and we could show you our total number of tests, and those are just factual numbers. And if we calculate that rate and we do it over 7 days, it equals what we're showing. That's right. And if people want to use Johns Hopkins on Travel to Us, that's fine. We just needed a resource that was easy for people to go to. And what a challenge it would be if we had to calculate other states' positivity rate, each and every day. So that's fair that they, I don't know what numbers Johns Hopkins are using. I know the numbers that we're using. All I can tell you is our numbers of overall tests that come in and our numbers of positives are fully transparent in where we are. But whether we've gone from 2 to 4, and I think they had us higher before, or 4 to 7, cases are increasing, and it's not a good place to be. If we want to treat ourselves like we're at 7, I think we are, with the extra steps that we're taking. Hi, Debbie. The question is on, with increasing cases, Derby and fans in the stand. We still have time to get this under control. Our hope is that we will start seeing results from the mask requirement by early next week, and we see other results that we are taking. We do believe that starting really July 5th, people have changed their habits. They've seen what's going on, and our hope is that we will start seeing first a stabilization and then a decrease. But I think all of us are watching day to day where this is going, and all of us are going to want to make sure that anything we do is a safe environment. All right, I'm going to try to do this round quickly.
With the travel requirements, obviously you have 9 states up there, but this stuff changes. I mean, how often are you going to be updating which states you have to be careful about, and are you recommending that people look at the specific town that they're traveling to and be conscious of the positivity rate of the town that they're traveling to?
So the question is on, are we going to be first updating the website based on changes in positivity rates? Yes. And I think we're going to do it regularly. I don't have an answer for you today on whether we're doing it daily at the moment, since we just put it into place the other day. But I think we got a responsibility to those states, and I'm not trying to put blame on those states. They're working hard. They're facing some grave circumstances, and we wish them the best. If people are traveling into those states, you shouldn't be. And you can look at the city that you're traveling in, but you're still going through the state, and we just ask that you don't do it. If you're traveling anywhere else outside of those states, yes, I'd get online. I'd look at where you're going. I'd look at what the situation with COVID is right now. The one thing we've got, while the public information is imperfect, if you look at COVID Act Now, it's a little different than the reopening website and a little different than Johns Hopkins, but there's a lot of information out there. And if it helps you to make a good decision, I'm excited that people would be going through that process, because it would mean that safety is first and foremost in their minds. Tom, I got to answer a lot faster than that.
Okay. Governor, the Ernst & Young contract expires at the end of the month. Will it be renewed, and how many outstanding claims do we have now?
So the question is on EY's contract. I believe we had 29,000 claims that they had processed, and I think are awaiting our final approval. Somebody's got to go through and say yes, 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 yes. That's going to significantly reduce outstanding claims. We have more initial claims that we've got to resolve than that. If we hit the 50,000 mark that we would like, that's going to get us close. But we still have some issues out there with second-time claims, and we still have a lot of claims coming in each week. So we're going to look at whether or not we need to renew that contract, and we'll get you the numbers. It depends on which area you're looking at. I know we're below 5,000 for initial March claims now. We think we'll be way below that. But what we weren't pulling out before, and it's throwing off our numbers, is we had people who would file a month later, but if they had one day in March that they were claiming, it'd show up as a March claim, even though our folks didn't have it to actually work the claim until much later than that. And that's something that we should have addressed in our numbers. That's not something anybody else would have known. Question is on the Kentucky State Fair. I think similar to the question on the Derby, we just need to get a hold of this virus. I hope everybody involved in all of it wants it to be a safe experience. If we see our facial coverings stabilize, we'll know that that's one very good tool. And I think for all of these large gatherings now, kind of like Lynn Family Stadium did with the soccer game in Louisville, which appears to have been done very well, that mask requirement's going to have to be really enforced. Social distancing really enforced. I've now seen that you can put something together and you can put all the right rules down, but if you don't have somebody out there reminding people to do it, sometimes they won't do it. Lawrence?
The unlimited emergency days for school staff, how does that differ from what they have now? How about the impact of that? And could that potentially lead to staffing problems?
Well, I'll let the Lieutenant Governor talk about the change in days to the unlimited for quarantine, but I think we've got to expect and plan for schools in the age of COVID to have staffing problems. And how are we going to fill that? How are we going to bring in outsized resources? We got to have a plan for that in each school district, because it's just a real possibility.
So just real quickly, typically districts will extend 2 or 3 emergency days to educators. So the issue we came up against was what happens if teachers or bus drivers or cafeteria workers are exposed to someone and not necessarily contracted the virus, but has to be quarantined until they get a test back. That would allow them to use these emergency days in that way. So they're not using sick days unless they are actually sick, but because they are coming to work and working with a huge number of students and families, that if they are forced to quarantine for safety reasons, that our districts now can extend these emergency days for COVID-related issues. Okay.
2 more. So the question is, do I have concerns with I think what you call vaccine confidence? Will enough people take the vaccine once it's out? I have concerns about everything. That's my job right now, and dealing with COVID. If we have what appears to be an effective vaccine, I think we can deal with that then, and we can get it done. If we have an effective vaccine, I don't think it's as much talking about the vaccine and its safety, though it has to be safe before we ask people to take it. It's all the things that we can get back to doing once enough people take the vaccine, and the fact that we can't until they do. But that does put a very substantial duty on those that are testing it to make sure that it is truly safe. All right, last one. So cases in small children is the question. We are seeing them all over the Commonwealth. Now we see more in Jefferson County because there are more kids in Jefferson County, and we see more people show up for testing in Jefferson County. But we are seeing cases in young children everywhere. We're seeing cases in young people everywhere. We're seeing, just take sports and high school sports and the training right now, we're seeing those positive outbreaks just about everywhere. We have daycares from, I think there's 30 daycares that have at least one case associated with them. That doesn't mean it's actively in the daycare, but it just means that it can pop up anywhere and doing the right things. And I think keeping that class size small is really important. All right, so we've had a tough day on the overall number of cases, but we have made changes. Changes that I hope, between going back down to 10 people for social gatherings, asking everybody not to travel to some of these states, and wearing these facial coverings, can get us back on the right track. We know how to beat this virus. We've done it before, but we've got to keep doing it. So let's make sure we come together. Let's make sure we all believe we're a part of Team Kentucky and do what it takes. We'll be back here tomorrow at 4 with the numbers we've been seeing. We think it's important to provide as much information and answer as many questions as we can. Thank you all.